Hi, I'm Scott, your joint pain specialist in San Jose, California. I get asked a lot of questions about the foot, like, how do you treat tendonitis in the foot? Well, there's a wide range of holistic treatments to enhance your healing and recovery from tendonitis foot pain. But recognizing the signs of tendonitis makes it easier to acquire help before your tendon completely ruptures. When you start feeling pain in your foot, the immediate recommendation is to follow RICE, rest, ice, compression, and elevation. Generally, treatment for foot tendonitis involves stopping all physical activity and applying ice to the affected tendon. Then use a compress to apply pressure. When lying down, raise your feet above the level of your heart. Wrap the affected area in a compression bandage until the swelling decreases. Another way to treat tendonitis in the foot is doing exercises and stretches to strengthen and improve mobility of the affected area. Another question I'm asked is foot tendonitis treatable? Well, yes. The basic idea behind treatment for foot tendonitis is to take rest and allow your body to heal from the injury. It may take several days, weeks, or even months. In many cases, tendonitis is treatable with rehabilitation and series of specific exercises. In serious cases, mobility may be limited and a brace might be required by a doctor in order to recover. After that period of recovery, strengthening and rehabilitation is needed. Usually, the last question I get asked is there a non-invasive approach for treatment? Oh yeah, but some doctors, they'll prescribe pain medications, steroid shots to relieve the pain, then physical therapy to strengthen the muscles on your tendon to lower the stress around it. While pain medication is a direct approach to the pain suffering, it may not be the best option. Muscle activation is much like physical therapy with the difference of addressing the root cause of the pain instead of only the surface pain or symptom. This is why MAT has become the leading technique in pain management. If tendonitis is treated early, it usually resolves very fast. For individuals, it can reappear and become a long-term or chronic problem. However, changing the behaviors that led to tendonitis, such as overuse or repetitive movement, can lower the risk of it occurring again. Listen to your body, and if you start to feel pain in your foot or ankle, seek a specialist for advice.